Hearing words and phrases being used by the hospitals we haven't heard really since a year ago when this whole thing started. Now, those triage centers you mentioned already set up at the Grosse Pointe location, the Beaumont location there. Farmington Hills, Dearborn could be next. Now, outside, you wouldn't know it. It's relatively business as usual, but it's inside on those COVID units that's pushing doctors, nurses to the brink as they continue to admit more COVID patients.
When I first came in, it was like a war zone. I couldn't believe the amount of people that were everywhere and needed help and were in the hallways and just the overrun.
1 week in, admitted to the COVID unit at Beaumont Hospital, Dearborn, 55-year-old John English, one of more than 800 patients admitted among their 8 hospitals.
The biggest concern was probably, I guess I have a blood clot in my lung, which we just found out a couple days ago. Besides that, I lose breath when I get up and try to walk around a little bit. I guess I'll be going home on oxygen.
John was scheduling his vaccine appointments when he got sick 2 weeks ago. It's clear staffing at the hospital is stretched. Beaumont is pulling from the outside to backfill.
Everyone's been great, very compassionate, very understanding, more than helpful, considering everything going on.
Our strategy at this time to get to the other side of this pandemic and to flatten this curve is really about making sure we're getting as many people vaccinated as quickly as possible.
Dr. Nick Gilpin and the Centers for Disease Control agree. Vaccines alone won't get Michigan out of this surge. Gilpin says we do need more policy restrictions right now.
The difference in the first surge that we experienced was that there were restrictions in the community to limit gathering sizes and limit indoor activities.
Meantime, they're setting up triage stations outside of some of Beaumont's locations to accommodate the influx of COVID patients. John English is expected to be released in the next couple days.
Try to follow all the protocols because this is not someplace you want to be or can even try to get into, really, because they're very, very overrun. All the hospitals are.
You heard that infectious disease doctor. He said he would support restrictions, policy restrictions put in place right now. We asked the governor's office about that today. They referred me to her comments yesterday on the issue. She says that policy is not going to stop this spread. It's people following restrictions that are already in place and doing what we already know and have been doing for a year now. Live in Farmington Hills, Jessica Dupnack, Fox 2 News.
So, Jessica, is this patient overload having any impact on Beaumont's vaccine distribution?
Their vaccine distribution has been massive. They've vaccinated 250,000 people so far. It is causing to the stressor in terms of pulling staff and that logistical nightmare. Beaumont says it's not affecting the rollout right now, but it depends what happens in the next coming weeks and months in terms of this third surge.
Extremely critical condition. Jessica, thank you.